702.
The Naked Scientist.
Time for The Naked Scientist with Dr. Chris Smith, taking all of your science-related questions. Dr. Chris Smith, happy Monday. How are you doing?
Happy Monday. I'm very good, thank you. And how about your good self?
I am fantastic. There's a bit of a flu bug going around. I'm not sure if it would be the same bug going around by you guys, but it travels through little children and their grimy hands. And then we lose our voices and aren't on air for 2 days.
Yeah, probably adenovirus or just one of the rhinoviruses, actually. The reason I say this is, A, they're both very common. There are adenoviruses and rhinoviruses around all year round, but they particularly like this time of year. And they are really good at spreading. And there was a study someone did, and they found that in people who have rhinovirus infection, so this is one of the causes of the common cold, and there's about 100 different types of rhinovirus, about 40 or 50% of people, when they swabbed their hands who had these viruses, had them recoverable on their fingers. So in other words, everything they were touching, they were transferring virus particles to. And because these viruses are really stable, they sit in the environment for up to weeks at a time, fully infectious. So if you come along later and pick up that same thing that person was holding, open that door, type on that computer keyboard, and they've been typing on it, and they wiped their nose and they sneezed and everything else, or they're just a grimy kid, as you're saying, my kids are virus factories, then you're going to get it because they're really infectious, these things. So that's probably what you've got. Probably rhinovirus, possibly an adenovirus, both around at this time of year.
Either way, I hate it. We're opening the lines 011 8830702, the WhatsApp line 0727021702. Sarah from Santon, you have a question. Go ahead.
Yes, please. Good afternoon. My virus turned to shingles, if you'd like to know, but that's what I'm not.
No.
That's not what I'm phoning about. I've phoned to Dr. Smith often about macular degeneration. I just wondered if there's any improvement on what's going on, or any therapy or treatment other than Eylea injections. What about stem cell treatment?
Sorry to hear about your run-in with this. And for people who are not in the know or not familiar, this is a really common cause of sight loss, particularly in older age. And it comes in two forms. There's what we call wet and dry macular degeneration. And in both cases, it leads to damage to the macula, which is the most sensitive part of your retina, where if you're reading a book or looking at someone across the room or trying to watch television, this is where the light waves are being focused so you can see, because that's the area of the retina that offers our best visual acuity. It's how we discriminate detail in things. And for some reason, in some people, and unfortunately quite a few people, and particularly as we get older, this region of the eye begins to fail. And there are two forms of the condition, as I said, wet and dry, but they both add up to the same thing, which is a loss of visual acuity, because you lose the things that can see, the rods and cones that convert light waves into brain waves. Now, why does that happen? Well, in wet macular degeneration, usually because of an underlying condition like diabetes, but it can also occur in other conditions as well, you get patches of the retina which are starved of sufficient oxygen. So those release various triggers that say, grow more blood vessels and supply me with more blood to get more oxygen, please. Unfortunately, the blood vessels that form are poorly formed and they're weak and they're prone to break, and they bust open and you get hemorrhages into the eye. Those hemorrhages contain iron-rich blood, which can then poison the retina. And that's why it's called wet macular degeneration, because you've got this stuff being secreted from these new blood vessels into the retina, and then you lose your photoreceptors, your rods and cones. In the dry form, you don't see this degree of hemorrhage and vascularization, but you see a buildup of material which clogs up the back of the retina, but also then starves the important parts of the retina of the nutrients that they need. And this is treated in a slightly different way, but again, you lose your visual acuity. Now, what people are trying to do about it, we heard reference to one of them from Sarah, which is that you can take various drugs, usually injections, of a substance into the back of the eye, which suppress the growth of new blood vessels. This is a way of soaking up a chemical called VEGF, or vascular endothelial growth factor, to give it the long name, and that is what promotes the the vascularization or the new blood vessels that are weak and leaky. So if you block that signal in that part of the eye, it stops that happening and it stops the disease worsening. There are also ways to zap the vessels with lasers so that they don't break, and this can help to prolong the function of the retina, although you do get some damage because of the laser. And then people are saying, well, is there anything else we can do to improve visual acuity in people who've already lost visual acuity? And this is where the reference Sarah made to stem cell therapy comes in. People are now looking at ways of making patches of stem cell tissue which can be implanted at the back of the eye and can wire themselves into the surviving parts of the retina and help to contribute to retinal function. This is very much in its infancy. It's not de rigueur or mainstream yet, but it's certainly something they're working on. And the other option, it's also being worked on, is to produce a prosthetic device, effectively a light-sensitive microchip, a bit like the thing in the back of your digital camera on your mobile phone, where a chip sees the world and then produces a pattern of electrical impulses which are relayed onto the nerves that form the optic nerve to send the signals to the brain. And this is also in its infancy, but also being trialled in some patients.
Thank you so much, Sarah, for that question. Interesting one that's come through from Logan in Edenvale, who says, Dr. Chris Smith, do you help your kids with their science projects? And if so, how far do you take it?
Well, actually, we've got one child who's about to do his GCSE exams, which you take at 16, and my daughter did hers last year. And my daughter's now halfway through her A-levels, but both do science, and my daughter's very interested in doing something to do with science. Don't know what my son wants to do yet. He does a range of things, and he's very musical, so we're watching to see where he might like to go. But yes, I do give them a bit of help, and my daughter's writing a project at the moment for school all about how we're treating depression in new ways with things like psychedelics and that kind of thing. And so she was asking me for some things, because I've interviewed a lot of people who are working on this. It's very interesting that for years we've tried to treat depression in a range of ways, usually with drugs that push up the levels of various nerve transmitter chemicals in the brain. But more recently, people have noticed that some unusual and previously abandoned mood-altering substances seem to be very effective, and they include the drug ecstasy, also magic mushrooms and LSD, and also the anaesthetic agent ketamine. And we know that they make a difference, but we don't know why they work. And so she's writing a piece of project work about this sort of thing. So yes, I do that, and I'm very embarrassed to say that sometimes questions come up and I can't do them. So if anyone if anyone would like to help me when I have these situations and would be my phone a friend. We had a maths question at the weekend, couldn't solve it for love nor money, had to phone another child who was 16 who did know how to do it. And also some of the sort of science that they're learning these days was just not on the syllabus. I don't think it was even thought of when I was at school. So I just never have come across it. So yeah, sometimes I'm sunk.
I'll happily be a case study for you and your daughter. We can offline around the issue, because I've been exploring the microdosing and the ketamine therapy, and you and I will have an offline around that one. Let's go to Tsepo Randburg. You've got a question for the doctor?
Yes, I've got a question for the doctor, and I want to know what is the cause of someone to lose a sense of smell?
So the cause of losing sense of smell, doctor, and we know that was a big thing during COVID.
Yeah, well, I was just going to say this really came to prominence during COVID, because quite quickly in 2020, we realised it wasn't just a cough and a fever that was a signature of the incipient arrival of COVID. People started to complain as one of the first symptoms of loss of their sense of smell. And don't forget taste, because although we think of taste as chiefly something going on in our mouths and on our tongue, most of what we call taste is actually going on at the top of our nose. And at the top of our nose is a patch of tissue called olfactory epithelium. And this sheet of tissue has projecting through it and out of it sprays of nerve endings, which are olfactory nerves. There are specialised nerve cells there which are decorated with chemical docking stations called receptors. And these are sensitive to specific molecules, or molecules with a particular shape or chemical nature. And when we smell something, what we're actually smelling is a cocktail of different molecules which are volatile. They're floating around in the air. They go up our nose, or we put something in our mouth and it releases these substances. They go to the top of your nose and they dock with these receptors and activate those nerve fibres. those nerve endings signal to a structure called the olfactory bulb, which is a bulb-shaped projection on the bottom of your brain, which then relays the signal into your brain's olfactory cortex. So in other words, there's a sort of relay system going on where a chemical comes along, it fires an impulse in a nerve or a constellation of nerves. Those nerves then relay the signature into your olfactory bulb, and that then tells your brain these are the smells that are present. So if someone loses their sense of smell, it has to be for a number of reasons. One is something's damaged the receptors, the nerve cells at the top of your nose that are enabling you to respond to and detect those chemicals. That's what COVID was doing. It was damaging the detectors so that you were effectively, I don't want to mix metaphors, but blinded to the smells. The next thing that can happen is that where those nerves project into the brain to the olfactory bulb, they go through a structure called the cribriform plate. It's basically like a sieve on the base of the front of the brain where the nerve endings go through this sieve, the holes in the sieve. And if you have a head injury, shake your head violently, this can tear the nerve endings apart and they don't reconnect. So you effectively rip the wires out the fuse box, disconnect things. Now, there's one other fairly rare form of anosmia, loss of smell or taste, or absence of smell and taste, and this is because of a condition called Kallman's syndrome. And under these circumstances, people have an embryological thing going on where the cells that do the smelling don't end up in the right part of the brain, so they don't get connected to in the right way. So in other words, it can be because of infection or trauma, or also because of, in some cases, a genetic reason that people have anosmia.
Thank you so much, Tebo, for that. And let's go to Thibaut, the foodie in Joburg. You've got quite a current question. Go ahead.
Is cloud seeding an actual thing? Can we go up into the clouds and command them to rain? Is that an actual thing, or is social media just being chachara? That's my question for the day. Thank you.
And that's a brilliant question. Thank you so much.
Yeah, and I reckon
Thibaut.
the reason you've answered it is because of what happened in Dubai. Because last week when we had this very, very heavy rainstorm in Dubai, which brought 2.5 years of rain in one day to Dubai. And this led to catastrophic flooding, of course. And people speculated, a number of media outlets speculated and said, is this the product of cloud seeding? Because the United Arab Emirates, Dubai, various places do this. And it does work. And there was some reports that they've been doing this recently, and so some people said, well, that must have caused this catastrophe. Well, the fact is that if it were that easy and they've been doing this for years, they'd be having these sorts of catastrophes far more often. So while cloud seeding can make it rain, it probably didn't cause what happened in Dubai, and that was a freak weather event that was probably a big storm. Well, we know there was a system in the area. We know that climate change is intensifying these sorts of weather extremes, and possibly the cloud seeding could have added a little bit on top, but probably a fairly trivial contribution. The vast majority is going to be down to chance. But yes, it does work. It can be done. And in fact, the most notable example of this is around the time of the Olympics in Beijing. The Chinese used weather forcing, cloud seeding, to keep the skies clear, not just of smog, but of rain over Beijing for the Olympics. The way it works is that you fly aircraft high in the atmosphere and you use what's effectively like a crop sprayer to deploy into the atmosphere tiny particles, usually iodide crystals, which act as nucleation sites for raindrops to form. Water likes to form droplets around physical things. And up in clouds, that's particles of dust and smog, even dandruff, believe it or not. There are bacteria that live in clouds and they make this happen. Water droplets form around these tiny particles that the aircraft put into the atmosphere. And when you've got a small droplet, that makes it much easier for more water to join the party and form a big droplet. And once you've got a big droplet, because the force pulling it down by gravity towards the ground is bigger than the force pushing it back up into the cloud, it increases the chances of it raining. So it does work. It can be done. Did it cause the flood in Dubai? Probably not.
Thank you so much, Thibaut, the foodie, for that question. All of your questions, we will keep them for the next time when we get together again with Dr. Chris Smith.